There are many diagnoses that may seem similar to OCD. In fact, the new diagnostic manual that we use, the DSM-5, has grouped many of those together into the OCD and OCD-related disorders. So let's talk a little bit about them. One of them is body dysmorphic disorder, where I perceive that there's a flaw that I have that no one else can see on my body. So I might think that my head is too big for my body, or that my fingers are too short, or that there's a scar here that I can see, but nobody else, even looking very closely at me, can see that scar. And there could be what appears to be a lot of compulsive behaviors. Very much a focus on looking in mirrors all day long, buying various creams or things, even maybe getting medical procedures done that aren't really necessary in order to try to fix the perceived problem. Because it's so focused on the body and on that perceived flaw, body dysmorphic disorder is a better diagnosis than obsessive compulsive disorder is. Now, someone could have both, because if someone has obsessions, which are intrusive thoughts, images, or urges, and compulsions, which are behaviors or mental acts that people do to neutralize those intrusive thoughts or images or urges, they could have those going on in addition to body dysmorphic disorder. In a similar vein, you might have trichotillomania, which is hair pulling. And that could be very compulsive appearing as well too, where people will either pull the hair or they'll pull it out. They may play with it. Some people even eat it. And some people eat enough of it to the point that they get something called a trichobazor, which is a big old hairball in your stomach. And some people even require surgery to have that removed. There's some of them that have been up to about 9 pounds. So I would recommend not eating your hair. It's not a good thing. We don't really digest hair very well at all. Hoarding disorder used to be considered OCD, but there was always a problem with that because people who were hoarding very often liked the hoarding that they did. And we know that people with OCD don't very much like their OCD whatsoever. So hoarding is now a related disorder because there appears to be some similarities to OCD in terms of difficulty stopping gathering items and the difficulties with throwing something away and a lot of anxiety around those things. But it is now its own disorder, which turns out to be, I think, a very good decision on the developers of the DSM-5. We'll also see that people with OCD probably have higher levels of anxiety disorders than the general population would as well. Sometimes people with OCD might get diagnosed with generalized anxiety disorder because they worry about so many things. But the big difference between generalized anxiety disorder and OCD is the experience of compulsions. People with GAD spend time worrying all of the time and maybe have some physical symptoms that they don't like difficulty sleeping, muscle tension, things of that nature. While people with OCD have the worries or the intrusive thoughts or images or urges, but then also the compulsions, the things they do to neutralize those thoughts, images, or urges. There may even be OCD that develops after a trauma. So some people might have some kind of traumatic event in their life, and then over time start to think, had I just done this thing or that thing, maybe that trauma wouldn't have occurred. And that over time could develop into compulsive types of behaviors and even obsessions, a fear of what if this thing were to happen to me, or a fear that I might do this certain thing. So now I have to do these compulsions to prevent it from happening. Compulsions can take on that magical thinking kind of experience in that type of situations. If you think that any of these other disorders are a problem for you, I encourage you to find some help for those disorders. All of them are actually quite treatable, and there are specialists out there for them. If OCD comes along with any of those disorders, reach out to us at NOCD. We would be happy to work with you on the OCD and partner with another therapist who might specialize in one of those other disorders that we've discussed today. That partnership can be really essential in helping you start to live the life that you want to live again and not have OCD or one of those other disorders interfere in your day-to-day functioning. So reach out to us at treatmyocd.com or nocd.com so we can see if we might be able to help you on your journey of recovery.